Hello, hi. Welcome to another exciting video about the cardiovascular system. This is Dr. Sham, and I welcome you all. We're gonna talk today about the different sounds that are related to the cardiovascular system. So we're gonna talk about the normal heart sounds. Okay, we're gonna talk about then some abnormal sounds, which are murmur, that are produced in the heart, bruit, that's produced outside the heart, click, venous hum, and the pericardial rub. Okay, we're going to talk about how these sounds are produced and the different conditions in which we can expect such sounds. Let's start from the normal heart sounds. We know that it's S1 and S2. So S1 is produced by the closure of mitral valve and the tricuspid valve. So mitral valve is on the left side between the atria and ventricle, tricuspid is on the right side between atria and ventricle, and S2 is produced by the closure of aortic valve and the pulmonic valve. Normal heart. In the normal heart, the closure of the valves produces the sound. The opening of the valves do not produce the sound. Okay, we said that the S1 is produced by closure of mitral and aortic, tricuspid valve. It's not simply that these valves are just closing and snapping like clapping and producing a sound. It's something more in detail. Let me tell you how this S1 is produced and S2. Let's talk about the S1. Okay. Okay, let me draw, say for example, this is the left heart. Okay, if I can produce that. Okay, that's great. Okay, this is aortic valve. Okay, and here there is the mitral valve. Okay, now as I said, that it's not simply just the closure of the mitral, because this is the left side. So mitral and this side on the right is going to be tricuspid valves. Just not simply the closure produces the sound. You know that these mitral valve and the tricuspid valve, they are attached with this structures like this called chorda tendineae, and here they are attached to the ventricular wall by the papillary muscles. Okay, and these are the leaflets of mitral valve. So what happens is that, okay, when the ventricles contract, okay, it produces the back pressure, okay, and that leads these mitral valves to close. But the ventricle contract very forcefully, isn't that? So what happens that if there are no chorda tendineae and these papillary muscles, these leaflets might overshoot and they can bulge into the atriums. Same on the right side as well with the tricuspid valve. So basically this apparatus, the chorda tendineae and the papillary muscle, they keep the leaflets, the mitral and the tricuspid leaflets at their position, and they prevent their bulging, otherwise there will be regurgitation. So what happens is that when the ventricle contracts, this chorda tendineae and the papillary muscle also contract. Okay, and the leaflets, they taut the leaflets. Okay, so what happens as a result, the vibrations are produced. Okay, and these vibrations in the blood here, and they are delivered to the ventricular muscles as well, and also to the chest wall, and that is what we hear as S1. So this is actually the exact mechanism. Okay, when the ventriculars contract, these chorda tendineae and papillary muscles also contract, and the leaflets as well to some extent, and this apparatus prevents the overshooting of these leaflets into the atrium. So as a result, the strong vibrations are produced in the blood here in the ventricle, and that's transmitted to the ventricles as well, and ventricle wall, I mean to say, and that are transmitted to chest cavity, and that we hear as S1. Similarly, this S2 is produced by, okay, closure of the aortic and pulmonic valve. So when they close, actually, okay, so what happens is that vibration of these leaflets and adjacent structure, they produce the S2. Okay, let's move to these are the normal heart sounds, S1 and S2. Okay, there is something that is called S3 as well. Okay, um, something more about S1 and S2. So S1 is actually a low pitch, okay, sound, but it's of longer duration. Okay, but S2 is high pitch, okay, but of shorter duration. Okay, so S1, that's produced by the closure of the AV valves. What I mean by that is mitral and the tricuspid valve is of the long duration because they keep on vibrating for a longer time as compared to the S2, because these are actually the S2 aortic valve, pulmonic. These are semilunar valves, and they are more taut as compared to the aortic AV valves, atrioventricular valves. These are that are the mitral and the tricuspid because they are between the atria and the ventricle. Okay, let's move towards the S3 and S4. Okay, so S3 and S4, these are actually low pitch sounds. S3, that is actually produced by the filling of the ventricles. Okay, you can say that in early diastole, okay, in rapid filling of the ventricles. Okay, like just keep in your mind like someone who's fluid overload. Okay, so the rapid filling of the ventricle produces the S3, but this could be normal in the children or healthy young adults. The other conditions in which the S3 could be is that pregnancy, you know, that it's a high volume, high the body contains high volume in the pregnancy, so that produces S3. Another very important thing is the heart failure, where the people are fluid overload, they produce the S3, and S3 could be in the mitral regurgitation. It's also called gallop, ventricular gallop. Okay. If we talk about the S4, again, it's a low pitch sound. Okay, and that is produced, okay, when the atrias, they contract against the stiffened ventricles. What I mean by that is, okay, if we see, if this ventricular wall is thickened, okay, because of say for example hypertension or anything, so it's sound like just splashing water on the floor. Okay, so this is hypertrophied, stiffened. So when the atria eject into the ventricle, okay, the blood, so that sound is produced. As I said earlier, sound like when you're splashing water on the floor. So it's a hard surface, so that sound is produced. So S3, we can say it is produced in volume overload, okay, and S4 is pressure overload. I think makes sense. Okay, one thing you notice that both these S3 and S4 they are produced during the ventricular diastole when the ventricles are filling actually. Okay, now we have discussed the S1, S2, S3, S4. Let's talk about the murmurs. Okay, so normally, okay, the flood blood flows in laminar fashion from one chamber to the other, or ejected into the aorta, or but if the flow is turbulent because of certain different reasons, we're going to discuss that one in shortly. So this, if that becomes turbulent, okay, that produces sound which we called murmur. um what's a different mechanism of the murmur? The first one is that which can produce the murmur if there is excessive flow of the blood across a normal valve. The valve is normal, but the blood flow that's excessive, like in pregnancy. So excessive flow can produce the murmur. So valve itself is normal, but there is excessive flow, um, and like in anemia or in pregnancy, so that produces a murmur. These murmurs actually in anemia and pregnancy, these are called functional or the flow murmurs, because that's just because of the increased flow of the blood across the valve. The second mechanism against for the murmurs could be um, flow is normal, like across the valve, but the valve itself is narrowed. Okay, so if the valve is narrow, there will be the turbulent flow across the valve. Now the fluid is okay, that's normal, but the valve itself is narrow, so that causes the turbulence of the blood when it passes through the narrow valve, and that produces the murmur. The third thing is that flow of the blood is in abnormal direction, like if it's a leaky um, valve, okay, or like that's in the regurgitation. Okay, so normally the blood flows from the atria into ventricles, but if there is a valve regurgitation, okay, so the blood will flow in opposite direction, okay, reverse. That produces the murmur as well. And the fourth thing is how the murmur can be produced is if there is an abnormal communication, like in AST and VST, okay, or the PDA. So blood flows in abnormal direction and where it's not supposed to flow, like in AST or the VST. So that produces a murmur. So these are the different mechanisms how the murmurs are produced. Actually, it is because of the turbulence of the blood, okay, either because of the excessive flow in anemia and pregnancy, but in that case, these are just functional or flow murmurs. They are benign. Major thing, if the valve is narrow itself, okay, so when the blood flows, it causes turbulence. If the valves are leaky, like in regurgitation, they are moving in an opposite direction. The blood is flowing in opposite direction. So from the atria, it's supposed to come into the ventricle, but if the valve is leaky, like in prolapse or regurgitation, it when the ventricles contract, it goes from the ventricles to the atria because of the leaky valve that produces a murmur, and then it's abnormal communication, like AST, VST, and PDA. I have a separate video where I have discussed how you can recognize the murmurs in detail. Now, next is the bruit. So, what is a bruit? Bruit is a sound that is similar to murmur, but it is produced outside the heart. That is important. Okay, outside the heart. So it's similar to murmur, but it's produced outside the heart. This may be either due to the excessive flow to an organ, either because of excessive flow to organ, or narrowing of a blood vessel. Narrowing of a vessel. Okay, let me give you the examples. So you know that in hyperthyroidism, okay, there is thyroid bruit in or the carotid bruit. You know that because of the narrowing of the carotid. Um, so this goes over here. Okay, let's break them down. Excessive flow, like in hyperthyroidism, okay, um, or in hepatic bruit in hepatocellular carcinoma. So these are because of the excessive flow. And if we talk about the narrowing of the blood vessels, you know, carotid bruit because of some atherosclerosis in the carotid, or the renal artery stenosis that produces the renal bruit. So you can see that these are like the sounds like murmur, but these are not in the blood but outside in the vessels. So another thing over here is the venous hum. Okay, this is actually a continuous murmur-like sound that's audible in the neck sometimes when the patient is standing or sitting. It is actually due to the kinking of large neck veins. Veins in neck, or because of the hyperkinetic jugular vein, jugular venous flow. It is common in the children. Okay, let's talk about another very important thing, that is pericardial rub. Okay, so you know that the pericardium has two surfaces. That is the visceral pericardium and parietal pericardium. The pericardial rub. Okay, this is actually a scratchy sound. Okay, it's just a scratchy sound that is produced when these two surfaces of the pericardium, they rub against each other, like in pericarditis. So the visceral and parietal pericardium, if there's inflammation like in pericarditis, so they rub against each other and produce this sound. This sound disappears, by the way, when the pericardial effusion is produced, because now it's a fluid between the two layers of the pericardium, so you wouldn't listen to any of the scratchy sound. So initially in the pericarditis, it could be the pericardial rub until unless there develops a pleural effusion, which results in disappearing the pericardial rub. Okay, lastly, we have here the clicks. So as I said, that opening of the valve doesn't produce any sound. If the opening of the valve produces a sound, that is called click. These are actually sharp systolic sounds. Okay, these are produced by opening of valve, definitely abnormal valve. As I said earlier, that normal valves don't produce any sound during the opening. Um, you can easily hear what's called, if someone is having a metallic valve. So opening of these valves, prosthetic valves, which are metallic actually, they produce a sound that is called metallic click. You can easily appreciate that one if someone is having a metallic valve. Okay, that's all for today. Hopefully I'm gonna see you in another video. Thank you.